Welcome to the final session of the 2021 Engineering Health Seminar. We've had two very exciting days with presentations ranging from deep research to clinical implementation. In the last session, it will be all about innovation. And I hope you will stay with us to the end of this session. My name is Bo Norman. I work as an innovation advisor at Chalmers Innovation Office and also as an advisor to the Health Engineering area of Advanced at Chalmers, the host of this seminar. My first task this afternoon is to introduce the next speaker, Angela Wolf. She will talk about her involuntary journey from research to applications. Angela is a professor at marine botany at Gothenburg University. She has a long CV that has taken her to the edges of our planet, from Arctic in the north to Antarctic in the south, in order to study one of her favorite subjects, marine microalgae. More specifically, it's about the marine diatoms and how they can thrive in conditions of low light and low temperature, and what can we learn from that to applications in various areas. So please, Angela, the screen is yours.
Thank you, Bo, and it's a pleasure to be here and once again being able to talk about my favorite subject, the diatoms. Well, I'm kind of involuntary entrepreneur, but I started, of course, and I'm still very much a scientist. The main character in this talk is the diatom. And the diatoms, for those of you that are not familiar with them, they are microscopic algae. They live on the seafloor or as phytoplankton. And each bubble you can see here is oxygen produced by these microscopic algae. And if you look at them, you see them here in the microscope. And the size is something between 10, 1, 2, 3, 10, 50, 500 micrometer in size. And there are a lot of species. So why bother? Well, I started as a scientist working with these microscopic algae, and I worked as an ecologist, marine botanist. I did experiments, and I went, like Bo said, to the Arctic and Antarctica. So how did I come from this setup to this, the Swedish algae factory, where you can see three fractions of these diatoms. The white is a powder, it's the shell. Actually, they are called frustules. The oily fraction is actually oil. It's very rich in omega-3 fatty acids, and it's also perfect as a biofuel. And the green is rich in antioxidants like beta-carotene, lutein, some zeaxanthin, fucoxanthin, for those of you that are familiar with that. Or from lab scale to industrial scale. So I had hundreds of cultures in laboratory in small bottles, and then later it got a large facility where we grow these diatoms in like trays in a greenhouse. I will talk more about that. This is about 300 square meters showing on the picture. I love diatoms. And I love being in the laboratory. I love doing analysis. I certainly love to be in the field. And you can actually see my window in the picture now with the corona situation. I have my own diatom lab in the window. I hate, truly, honestly, from my heart, I hate paperwork. That's not for me. But still, I wanted to explore the potential of doing something extra useful with my diatoms. And standing on the Antarctic ice, I got the idea about biofuel, because I had these ice algae, ice diatoms that grow inside the ice and just down the ice, and they grow in very low light conditions, and they had quite bad nutrient conditions, and it was very cold. So could this be a Nordic alternative? I said something like that during a conference, and then I have a champion, Camilla Pettersson at SIK, who said, well, Angela, why don't you take your ID to the ID evaluation course at Chalmers? And, well, okay, yes, I can talk about diatoms. It was nice to do a pitch about diatoms. So I spoke about the ice algae, the Nordic alternative for biofuel and beyond. David accepted me for the course, and well, I was about to say the rest is history. But I met Sophie Allert. She was a student on this course, and she worked with my ID together with some fellow students. And they gave it a positive evaluation. So let's take you to the Chalmers School of Entrepreneurship. Pitch again, ID accepted, and yeah, well, okay. I tried this. Not very comfortable, but still, let's give it a try. I mean, you know, as scientists at the university, you are encouraged to do something, maybe not commercialized, but something, you know, applied science or applicable with your research ideas or results. Luckily, Sophie Allert again was part of this School of Entrepreneurship, and we were incubated at the incubator. Now we talk about Chalmers Ventures. And it was wonderful. Suddenly I had a group of engaged entrepreneur students that worked with my ID. And in my mind, my vision was that, okay, they do the pitch contests, they do the paperwork, together with a very nice group also with business, coaches and the nice network at Chalmers Ventures. So maybe then I can just step aside and continue with my Antarctic exploration and the diatoms. Well, it turned out that I'm a bit of a control freak, so I didn't really let loose on my ID. I wanted to be involved, and I am a nerdy scientist. I'm always concerned about the experimental design, replicate sampling, how many replicates, what variables should we test, what statistics should we use, and of course everything should be published in scientific publications, and blah, blah, blah. I talk about my research results all the time, and apparently for a company I talk too much. So in this entrepreneurship environment, I learned that give us estimates. What? No replicates? You have to think about the business plan. Oh my God. Market segment. I don't have a clue. Pitch contest. No, thank you. IP or no IP? IP? You mean I can't talk about my results anymore? Production costs, etc., etc. So my reaction was naturally, this is painful. However, okay, let's try it. It's a challenge, and I'm really in favor of challenges, and this was truly and is still a challenge. We came up with a beautiful vision. We want to be the world-leading producer of advanced materials from algae and a driving force towards a circular and bio-based industry. And the last part is really, really close to my heart, being a marine ecologist. So, Sophia and I, we founded this company, the Swedish Algae Factory. The name, by the way, is we were trying to come up with a cool name, and we have this, you know, Swedish house mafia, so maybe Swedish algae mafia, maybe not so political correct. So, okay, Swedish Algae Factory, let's stay there. And we want to create an industry that is positive for the climate, not only less negative. So with the diatoms, here it says algae because it's easier to communicate by saying algae. So we found a way to do this. Our vision was and is to use the whole package, to use both algae as biofuel from the oil, which was funded by the NOVA, and then also to use the shells. This is the shell, and I don't know if you can see this. This is a small marmalade jar This is 1 gram of silica shells from the diatoms. And the leftovers could be used as fish feed or maybe fertilizers rich in nitrogen, phosphorus, and antioxidants. Not suitable for human consumption because we grow them in an environment that is not controlled. Our first business model, this is in Swedish, it's so cute. We wanted to really clean water, and we could use water from the municipality, you know, the sewage, and we will have a nice biomass that we could use for different applications. And in the end here, we had fertilizers and biodiesel. And in fact, the oil could go directly into the refineries without any alteration. So that was a nice thing. But the reality, fossil fuel was too cheap. We didn't get any investors, and we needed to be flexible. So then we went for the algae shells, the frustules. And, sorry, I should also say that the oil and the other biomass could go also more or less directly to a land-based fish farm as fish feed, or an open water fish farm as fish feed. We are not yet there. So the frustule, this is a diatom without organic material. So you can see nanopores in the shells, and then below is a close-up of the pores. So this is a 2-layer silica pore, frustule. And the pores traps light, photosynthetic active radiation, or white light. It blocks harmful ultraviolet radiation, partly by actually manipulating the light from UV radiation to longer wavelengths. And also, this is the only connection that the diatom, the cells have with the environment. So through these pores, it's also gas absorption, gas release, take up and release nutrients and water, and of course carbon dioxide and oxygen. So this is a miracle material, honestly. Look at this. This is pure beauty. This is diversity of different pore structures from diatoms in the field. And we have double layers, we have triple layers, and we have particular structures that you actually can find in engineering constructions all over the world. I mean, not used as diatoms, but the mechanics, the forces enlarged could also come from diatoms when you look closer. I mean, this is really physics. So we got the trademark Algica, that is a high-tech material developed by nature. This is how we sell it. And as I said, traps visible light efficiently, blocking the UVR, absorb chemicals, and it's extremely durable and stable because you can find fossil diatoms from millions and millions of years ago. They are somewhat, you know, they are not as good as the fresh ones, but you have them. And there is a good quality also, and it's consistent. That's nice. We can use it in solar cell panels to increase the efficiency, and that is also important that 1 kilo of this Algica reduces the carbon dioxide with about 200 tons yearly. So it is indeed something good for climate change effects. And the DSSS dye-synthesized solar cells, we have an even larger effect, higher efficiency. This is still in lab conditions, and it's tested in the field, and it's published. But in personal care, and this is also interesting, like for healthcare, because it works as a sun protector, a booster. Apart from being a moisturizer, cleanser, rheology modifier, antipollutant, etc. So we have so many possible tracks with this material. It has also been shown to be able to deliver drugs. So it's a biomaterial that can deliver drugs inside your body. It has been done in lab scale, not by us. So the traction now, of course, we have this with patents. We have, I don't remember if it's 2 or 3 patents now, and we have a pending one for the solar. We have one in the personal care industry and also for the cultivation setup. So, okay, I surrender. I had to go into that, and I had to learn how to be a bit more silent and not speak so freely of the results. It's still very important to be circular, sustainable, but still, in a way, profitable. So we want to use, we use water from a land-based fish farm rich in carbon dioxide, solar radiation in the greenhouse, cultivate the diatoms, get back oxygen to the fish. We clean the water from phosphorus and nitrogen. The biomass can go back also to the fish as fish feed. But for now, we are focusing on the extraction with the advanced silica from them. So, am I still the involuntary entrepreneur? Yes, this part is still quite boring. And I want to say a word. I mean, I have so much help from Chalmers Ventures, so it's not that I'm complaining, but be careful with who you choose for your business coach, who you choose for your board member, investors, and IP, or no IP, the famous return of investment. But this is still so fun. It's so fun to start a company and follow along the journey, also with the paperwork. To be honest, this is not my only idea. This one, fail. Solid shampoo with algae, fail. Algot, the first use, chlorella de ville, we came so long. It was so close. Fail. Hobby project, horse jump together Maria Sedin from physics, Snutan Sedell from biological and environmental science, and myself. We had this horse jump on the European Championship. And of course I have a new idea. Maybe help the ocean golf ball. That's a teaser. We will see about that. Upscaling, now we're talking. This is in Kungshamn, large facility, and you see two people down to the left. And this is the team. This is our employers, around 10 employers now, and upscaling. I'm happy to see that. So if you have an idea, let the business incubators work with it and decide if you want to be in control or just an idea provider. If it gets wings, it's absolutely wonderful. If not, you all learn something along the way. And with that, I say it's not always a matter of genetic engineering. Sometimes it pays off to be pragmatic. That's all, folks. Thank you.
Thank you so much, Angela. That was really illuminating talk. And I must admit that back in the day, once I've done some studies on ice algae in the Baltics to see how they oversummer, which is the challenge there, instead of overwinter. But that was sort of a long time ago. But you brought up a lot of interesting things. And one thing I caught from your talk was this change the mindset from research to entrepreneur, this good enough thinking. And could you elaborate a bit on that?
Yes, it is still a bit painful because, you know, you want to be certain, you want to give proof, you want to give evidence. But the industry is not so interested in this fine scale, fine tune setup. So for me, it's kind of, yes, it is painful. I have to change my perspective and see the broader context, the good enough context. And I work with that hard with myself every day still. But now I can also see that something happens. We have a company, we have employers, we're doing something good, and we trap carbon dioxide. So that makes it easier to let loose, so to speak. So
in a way, it's kind of making this journey, as you said, from maybe starting by understanding nature to doing good, to actually doing business, which is...
Yeah.
Another thing I caught from that, and the last thing you said about capturing carbon dioxide, because I was kind of stupefied. You said 1 kilo of your material could trapped or be used for trapping 200 tons of carbon dioxide. And I just saw some company today that wanted to get people to invest in direct carbon capture, where you would pay 6,000 crowns to capture 600 kilos per year. And this to me brings up the sort of maybe what you're working with also is the undervalue of natural solutions when it comes to solving the climate problems.
Yeah, yes, I totally agree with that, because I'm not against, to the engineering solution. I mean, I think today we need to work on both fronts, so to speak. So, but still, engineering won't solve our problems with carbon dioxide emissions or to store carbon. But we should also be very much aware of that this is a zero sum, with photosynthesis and respiration. So the sum is about zero. But this is something that we grow now. We are not burning fossils or use the fossils buried in the ground or as gas. So it's not like it will solve all the carbon dioxide problem that we have now. So we need to also to work on carbon storage, for sure.
And another thing, coming back to this, I was also really liked one of your last slides where you were talking about all the different ideas you have tested, but maybe didn't really make it. And this thing, which also kind of the personal development going, I mean, once you've started doing innovations and becoming sort of an entrepreneur, it seems like it's kind of hard to stop.
Yes, it is, because I always had so many ideas in my drawer, but I don't execute them because I hate these paperwork things, and I don't want to call investors. I don't want to play that game. So I need a team around me. And I found that team through the ID evaluation course in Chalmers Ventures. And these incubators are so important. I can't stress it enough.
Yeah, and I've had the pleasure also to working with Sophie, so I know how much she's contributed to this. So where do you see, I mean, nothing is maybe perfect, but what else you say is important to have the right people around you, but what else do you think is needed when moving from this role as a sort of pure researcher to someone who is at least doing part-time entrepreneurship?
I think meeting places. We have started now with these meetings, because I also get a lot of my ideas from listening to all other talks yesterday and today, and then I feel like, I should contact this person because this person is working with something that might have use of my diatoms, or I might have use of the inventions from this person. So to create places where we can discuss, and also where we discuss in a layman manner. So it's not, in-depth science and all the details, but first just create the ideas, and then we meet, and then we can speak the same language, and then we can actually make a business together. Not necessarily a business, but make something good together. For example, I have started collaboration with in biophysics with an Italian group, and that is also something extra coming out now from the very start with the cultivation of the diatom.
Well, in the panel yesterday, which was all about collaboration and also describing the environment in Stanford, there was a lot to talk also about the financing, the capital. What sort of what have you encountered when it comes to financing, which is, of course, one of the important aspects when you start up a new company?
Okay, I say it's crucial to have a start capital, something you can start with. And then you also need to find the right people in the business sector or in the incubator that believe in your idea. I warn about some business coaches. We had some in the start that they didn't believe in biological material, so they didn't help us much. You need to find someone that believes in you and help you also to find investors. So, I mean, if you're on the front line of a business that is not yet there, then you need to be encouraged, and you need people to talk for you because you don't have the time yourself. I must say it's not always about getting millions and millions in the start. In the start, you need something to be able to test to see, is it even possible? Is there an interest in the market? You need someone to help you with that and finance that part. You also need someone to see if you can get an IP, because industry is usually asking for IP. Could you get a patent out of it? Even if maybe it's not the best solution, they ask for it. So these kind of supports are, in my mind, you need that more than you need actual money at the start.
Your work in the marine area, and we are living on the west coast of Sweden, which is sort of the only really marine region of Sweden. Are we doing enough with sort of utilizing the potential of the ocean in Sweden?
No, not at all. We have, but okay, on the west coast we have these collaborations along the region and also further south, and we have these initiatives with scary seafood, algae cultivations, and also more towards biotech. But there is so much more to explore. I don't know why we are afraid of the ocean or the sea and use what we find there. Okay, it's not, I mean, you don't know what's going on beneath the surface. Maybe it's a matter of education. Maybe that we, marine biologists, we are bad in educating people. But also just looking at the school book, it's all about rainforests and forests and plants. It's a very, very small portion that's about the ocean. And still half of the oxygen we breathe comes from the ocean. So we know so very little of the organisms still and the marine ecosystems. And it's so much to, in Swedish I say, nyttja, not utnyttja. I don't know the word in English.
So it's more about sort of knowledge than, for instance, regulatory aspects, or is that also a problem?
Oh, yeah. Yes. I showed that we work together with the land-based fish farm. They didn't get their permit in a very long time because it's not within our legislation, and it's not said fish farm or mussels or tunicate or whatever. We are lucky because we grow what is considered plants in a greenhouse, so we don't even need the permit. But if we wanted to put our cultivation system into the ocean, then it had been no. So there is a lot to be done with the legislation, and it's an obstacle, for example, for the land-based fish farms. So yeah, that's a challenge.
So
it goes too slow. It's far too slow, I must say.
Okay. So we have something to work with there. And that comes back to another aspect of this. I mean, when we talk about solutions to the challenges ahead, I mean, climate is one of the real black elephant. What's the potential for scale and speed with what you're working with? I mean, given that if you had enough funding, how big is the potential? How big can you scale?
I mean, we have been lucky. We have also, it's a lot of hard work, but we won the postcode lottery, the Green Challenge, and we got the 50 million, and we got 5 million Swedish crowns there, and then that attracted an investor that invested 50 million Swedish crowns in the company, and it attracted a company that was ready to risk the money because they could see that we are doing something good. So it's a matter of the sector you're working on, if it's medical sector or if it's this carbon capture sector, and what material you are using, and the mindset of the investors. But to answer your question, we are heavily relying on funds, scholarships and funds at the start. And then when you see that your ID, you can expand your ID, then you attract investors. And then, of course, you need money to scale up, because it will take we sell the material, but it will take us 5, maybe 10 years before we have it as a working industry that pays off itself. Return of investment, right?
But you're going into the solar cell market. That should be an obvious growth area. It is a growth area, but
yes, it is, and we have promising results. There we have some technical challenges, how to incorporate our material into the existing solar cell and solar panels. They're now working, the experts are working on the coating, so we see that the coating is the key.
Is that research done locally or internationally?
Internationally. For now, it's both Chalmers are involved, researchers, of course, and also a group in France. I mean, a company is testing the material in the field.
Yeah, it should be, I mean, the potential with the new Horizon projects in the EU. I mean, your company should be an obvious sort of possible to attract funding there in the European.
We are involved. We are involved in a couple of applications that have started. But it's also, you know, I mean, we have some results in the lab, but they need to be verified in the field. They have been, to some extent, been verified in the field, but now the solar cell market is so, you know, so it's enough if we could have a 1% increase in efficiency. It's good enough. In lab scale, we had 4, but I mean, it's, yeah, as you say, there's a huge market there.
I think that's a good way to end the discussion. I mean, saying that when 1% is good enough, because I mean, as a researcher, when you're always wanting to be 95% sure of everything, that really is a different way of thinking. So thank you so much, Angela, for this very illuminating talk in many aspects. And we will reconvene in a few minutes. We will just reorganize a bit here. Thank you so much.
Thank you.
So welcome back, and now we are turning to a totally different but equally exciting subjects. So we'll hear about the program for innovation technology, the residency program in innovation technology, which comes from Sahlgrenska Hospital, and it's all about how physicians in training will learn about innovation technology from partners in academia and in industry. And we have with us Caroline Damgaard, who has been leading the first edition of this course, and Jakob Hermansson, who is one of the participants. I'd be really eager to hear about what you've done and your experiences. And I've had the pleasure to meet most of you during the last year, and I'm very excited to hear your thinking about this program. So please, Caroline, go ahead.
Thank you. My name is Caroline Damgaard, and I studied here at Chalmers University of Technology a few years ago, chemical engineering. And so it feels really good to be back here. I have a lot of good memories from this time when I studied. After I graduated, I started working at the innovation platform, VGR. And now I still work there as a project manager and course leader of the Innovation and Technology Residency Program. And this program is a collaboration between the education unit, SD-kansliet, as we call it in Swedish, at Sahlgrenska University Hospital, the innovation platform, VGR, and health engineering area of advance at the Chalmers University of Technology. And with me today, I have one of the first participants in the program, Jakob Hermansson. And together we will do this presentation and also hear a little bit about your thoughts about the program. So please, Jakob.
Right, thank you.
Yeah.
So my name is Jakob Hermansson. I'm a resident of orthopedic surgery at Sahlgrenska University Hospital, and I'm also a PhD student at Sahlgrenska Academy and a participant of this program. So I'm just going to start with a very brief introduction into the needs of healthcare and to why this program has come about. And I'm sure a lot of this gets iterated in other settings. And then I'll build up a segue to Caroline so she can tell you more specifically what we do. So healthcare today faces many of its own distinct challenges that sort of separate it from any other private and public enterprise. And this creates a need for a framework of innovation that can accommodate this. And to add to this, healthcare is facing numerous challenges in the future with a demographical development that will require a shrinking proportion of younger working age individuals to take care of an aging population. And the prevalence of chronic disease increases exponentially with age. And this, where society today allots maybe a few % of the working age population into healthcare, there are projections that in the 2050s that nearly 30% of these young new graduates in the picture will need to go to healthcare to sustain it. So many of the advancements of science and technology and society take place in an accelerating fashion. And there are many I mean, that really makes it hard to keep up. And it's hard for medicine to replicate and keep pace with some of the organic growth of technology in society and industry. I mean, there are many examples of healthcare doing a fantastic job of innovating and employing technology to better the lives of patients. And technological know-how grows increasingly important within medicine. And I would argue that medical school has not really prepared me for the general use of technology in many of the IT systems that I interact with every day at work, let alone their development. So the drive for innovation is not only coming from within healthcare. The evidence-based nature of medicine creates an innate divide between the new and untested and the known and proven. A foremost priority of medicine is to minimize the risk of doing harm. And not understanding how technologies work may create barriers to adoption. So in the bottom left here is a picture of a black box. It illustrates the unknown parameters and inner workings of an AI. Now, it's true that the mechanisms of some current interventions within medicine are not fully understood. Paracetamol is one example. But I was taught pharmacology in school, and that was a long course. But I have not received much formal training in medtech. And that makes the unknowns of the black box example difficult to comprehend. And some of these technologies are incredibly powerful and offer many potential benefits to patients. But it's not the solution itself that creates benefit. It's a solution matched to a need, and ideally a solution developed from a need. And who better to identify the needs of patients than the people whose job it is to ask them? Oftentimes there's already a solution or someone with a solution out there. How do we accelerate the development and adoption of technologies that can improve lives? And how do we match those in a position to identify the needs with those with the knowledge to solve them? How do we make sure that the doctor, Jacob, can get in touch with the engineer, Caroline?
Yes, we need to think in new ways. And I know that yesterday you talked a lot about collaboration, and I believe, and we believe, that that is one of the important keys to this. And as of 2 years ago, the hospital director of Sahlgrenska University Hospital, Ann-Marie Wennberg-Larka, initiated an education for doctors to give them tools and knowledge to innovate and to learn more about potential beneficial technologies for you. And this education is now called the Innovation and Technology Residency Program. And the program is part of the education unit at Sahlgrenska University Hospital, in collaboration with the innovation platform, and health engineering area of advance, which we're very proud of. And in November 2019, we had our first start ever of this program with 9 resident physicians, and Jacob, you were one of those. Right. And in September this year, we're going to start with the second team. So we're very excited about that. The course management consists of 2 groups, where Peter Kelly, a resident physician, you can see him to the left here. So him and I are responsible for the group started in 2019. And Martin Holmudden and Pontus Weinar, 2 resident physicians at Sahlgrenska University Hospital, are responsible for the one started this year. Peter Kelly is also a resident physician at Sahlgrenska. We also have a steering committee, and that consists of representatives from the innovation platform and the education unit at Sahlgrenska University Hospital. The aim of this program is to give doctors knowledge and skills to drive innovation within the medtech field at Sahlgrenska University Hospital, give them tools to affect their daily clinical lives, also be able to contribute to shape the future of innovation and technology at Sahlgrenska. It also aims to connect innovative forces within Sahlgrenska and to keep up with the growing international technology development. Yes. The program right now is addressed to resident physicians at Sahlgrenska University Hospital. In the future, who knows, maybe it will be a collaboration with other professions doing this program, but right now it's to resident physicians. And they do this for a period of 2 years, where each individual join for 20% of their working time, which means around 2 days every other week. And that also means that the people that started in 2019, they are more than halfway through. So the program consists of roughly 3 parts: theory, networking, and innovation project. And the theory cover both technology and innovation management. Technology such as basic knowledge and applications of artificial intelligence, machine learning, 3D printing, scanning, programming, and so on. And here we're very happy to have a good collaboration with the health engineering area of Advance, who's been part of planning and teaching during many of these technology days. And the innovation management theory consists of knowing different support systems in VGR, very important for innovation, knowing the innovation process of VGR, the different steps, service design, legal and regulatory aspects, innovation finance, how to get finance, and project management are some of these. Another 25% of this program consists of networking, a very important part, and that includes study visits, external placements where the doctors go and see how other businesses work with innovation and try to take inspiration from there back to the hospital. Collaboration events, and they also have their own mentor. And 50% of the program consists of the participants working with their own innovation project to gain practical experience of driving innovation based on clinical needs. And the goal with this is to learn how to innovate in practice. So each individual work all the way from identifying a need to solution and implementation. But how far they go with this during the program depends on what need and what solution they decide to work with. It's a high ambition, but that's our goal, so to speak. And a big focus is to work together with their own clinic. And we also have an external reference group participating during this process. And the theory and the networking part is a very important complement to be able to work practical with the innovation project. So this is 2 examples of 2 days we had together with Chalmers. You don't need to read everything that's on this. I just want to give you the example. So one day we had together with Chalmers was about infection and diagnostics, and one was about big data and artificial intelligence. And I don't know if you see this, but there's some people here from, a lot of people from Chalmers actually, who's been part here to teach. One of them is Martin Andersson, who was speaking this very morning. And then we also have Fredrik Höök, Fredrik Westerlund, Robert Fält, and Raquel Torkar, some of them. So we were very happy about this. This program is something very new and unique, especially because it's for resident physicians working with innovation within the public sector. And it's been a process, and it still is. We are still learning as we go, and we think it's really important to involve you, participant, in planning of the program all the way through. And now I want to ask you a few questions also, Jacob. Because you started almost, it's 1.5 years ago?
Something like that.
Yeah, and do you remember why you wanted to join this program from the very beginning?
Well, probably going to have to show me a copy of my application, but to be honest, I was probably mostly up in that top left quadrant of the slide we just passed with a general interest in technology. I was sort of enticed by the idea of working alongside engineers to solve our problems. And throughout medical school and training, I've sort of struggled with some of the technologies that I perceive as sort of archaic that we employ in healthcare, such as the pager and the fax machine, and a lot of the tedious tasks that can easily be automated. I didn't really know much about innovation and bringing technology and inventions into healthcare. I sort of thought that organizations did that in sort of a skunk works model. But it's been very insightful to learn about the importance of processes and structures and leadership that sort of facilitate entrepreneurship and innovation within an organization, and how important that is.
Yeah, and now you're more than halfway through, so at the end of this year you will graduate from this program as one of the first ones, together with your friends. That's why we're very interested in discussing what happens to you after you graduate, because you're the first ones. So these are some of the examples that we've been discussed together. Some of you want to strengthen the innovation culture in healthcare. Some of you want to be able to educate colleagues and leaders about this, or lead innovation project in healthcare with a technical focus, preferably. And some of you want to work more to ensure a good interaction between healthcare businesses and academia, and also a stepwise introduction of new technology in healthcare. And Jacob, you've been discussing this together with us. Is there any of these examples that you are more interested in working with after you graduate?
Well, I think these discussions are very important, so that this doesn't just become something we did for 2 years. And I've sort of positioned myself in the borderland between research and innovation. I'm looking to involve the stepwise introduction of robotic surgical technology in orthopedics into my PhD. And I believe that there's a lot of technologies out there that can be employed in healthcare and as solutions to many of the needs we're facing. We need to find ways of identifying the needs and evaluating technologies.
Yeah. And also, one last question for you, Jacob, before we end this presentation, about this program. Like, what has it given you so far?
Well, I mean, this COVID year has definitely been a challenge, and especially in regards to the networking part of it. But I think the most important aspects of it has been that it's given me time and a mandate to innovate, at least an informal mandate. And I think I'm optimistic that that's something that will continue in the future. That will be important for us to hold on to that.
Yeah, we will definitely will. But we were very excited for where you guys will go in the future.
Right.
So we will join you along the way. So thank you for listening. We don't have our email addresses, but hopefully maybe some can send it out. So if you want to contact us or hear more, so then you're very welcome to do that. Thank you.
Thank you so much for this. It's very interesting. And I would just like to pose one small question. We heard from Angela before how important it was with you getting to know the right people and the network. Do you feel that you would know what to do if you sort of stumbled upon an innovation now? Do you know where you would who to talk to and sort of a part of the process at least?
I would definitely have an easier time than I did before. Definitely, and I mean, it is something that I've sort of seen work. I mean, develop sort of organically in other aspects and other research projects. But it makes it a lot easier when you sort of know the right people and know the right pathways within an organization. And so, yes.
Very good. Thank you again so much. And I think this is a very good turnover to the last part of today's seminar, which is all about the panel. We'll hear about innovation. So thank you, Caroline. Thank you, Peter. Jacob. So now it's time for the final discussion. So we have a very interesting panel with the participants from research, academia, industry, innovation. And I will introduce the speakers as we go. And I will ask some questions about their views on innovation in the healthcare area. But I would also like you all to reflect on something we heard throughout these 2 days, which you really were struck about, or something you really wanted to bring up in the discussion. So with that said, I will start with the first question, and that will be a face that we've seen a couple of times already during these discussions. That will be Martin Andersson. He's a professor in chemistry at Chalmers. So Martin, we heard you talking this morning about your work with research of antimicrobial surface properties and how they could be applied on implants. And I know also you have this personal experience in taking research from the material science area to a company and the business relevant for the healthcare area. So what will you say, what was the most important factors you had to deal with in this process?
Well, thank you very much. It's a pleasure to be here with this interesting panel. I know many of the members of the panel. It's exciting to see you all. Well, it's a good question. I mean, there's lots and lots of stuff that you have to think about to take research, innovation into business. But probably the first one, the main challenge I face is the timing problem. Because when you do research as an academic person, we heard Angela talking about this before. You want to publish your work. I mean, this is the driving force for doing research, really. But you cannot publish things and then patent things. You have to do it in the right order. So I would say that a big challenge is when to publish and when not to publish. And that is something that I'm facing and have been facing for many, many times. And if you publish something, a new material or something you have developed, that might be the end point of that innovation to ever reach the clinic or ever reach any business. So you have to be very, very careful to what you publish and what you say. Being said that you need to patent, you don't want to patent too early, because if you do so, the clock is starting to tick. And 18 months later, you know that you need lots of money to keep the patent. So this is a big struggle. For how long can I wait before I can send in the patent, or should I publish? And for the business side of it, it's better to wait and then, of course, patent. But then you have PhD students and you have people that would like to sponsor your research and they want to see your publications and your research career in going in that direction. So I would say that this is something that is really troublesome and challenging. So when you get something, a good idea, something new, and you want to do a business or innovation, when should you patent and when should you publish?
And how did you get the support, or how did you solve that? And or is it a sort of ongoing struggle, maybe?
It's an ongoing struggle, and what happens is that you patent too early and you publish too late, and then you have to live with it. That is kind of the in that balance that you end up. So yeah, it's something that you need to struggle with all the time.
So Lotta Emlin Waula, you just left the Chalmers Innovation Office to a new position as Head of Business Coaching at Chalmers Venture, and I have happened to know that you've been somewhat involved also in Martin's project. So with your experience, past experience and your role, what's your take on what's the smooth transfer from research to the venture domain?
Oh, that's a great question. First off, thanks so much for inviting me here. Bo, it's great to see you, a dear old colleague. Not so old, it's just 2 months since I started at Chalmers Ventures. But okay, so a smooth transfer from the research domain into the venture domain. I would like to use an analogy of a relay race. You know, runners line up, you have a baton and you sort of pass it through, right? And the idea and the project that will be transferred into a hopefully sustainable growth company is the baton itself. And along the track, you have the runners lined up, and they all have their different actors, their different competences that you need in order to develop that baton forward or further. And those runners could be the innovation offices, it could be incubators, it could be science parks, holding companies, entrepreneurial educations, industrial hubs, regional initiatives, the world's the limit, right? Basically the innovation ecosystem in its largest extent. And then when you enter, I think it's important when you enter that sprinter track, it's important to have a joint idea of what does that sprinter track look like, because the road is going to be long, it's seldom going to be straight, and it's going to involve so many different actors. And then during the relay, it's important for the different runners to have similar, preferably the same, but a similar view of what speed and what distance each runner will actually take the baton forward. Because as you know, in a baton or in a relay race, if one runner stops and throws the baton at the next runner who's standing there doing something else, that's not really a smooth process moving forward, and it's unlikely that you're going to win the Olympic Games. So that's something that requires a continuous discussion and a continuous communication between the different actors. It means that we need to clarify our roles, our responsibilities, our boundaries, our conditions under which we work. We need to include each other and develop a joint view of the process moving forward, because each baton is different, each relay race looks differently and will develop differently. But if we at least continuously communicate with each other, I think we're better suited as an innovation ecosystem to support those innovative research results and ideas and innovators and entrepreneurs moving forward in that. And then, of course, there's a need for a sharing crowd that feeds in the energy and makes sure that all actors keep focused and aim for the goal, right? Or for the end point of the relay race. I don't know if that answers your question completely, Bo, but it sort of gives you a view of that it takes a team of different actors to work together with researchers, with entrepreneurs in developing strong, sustainable growth companies.
Well, I think it's interesting because a former dean of the Sahlgrenska Academy, which most of us know well, he often sort of presented this view that there should be the one way in for the innovation system. And what you say kind of contradicts this and more says that it is a team effort and we should pitch in our different responsibilities.
I think there's no wrong door, is probably what I would say more. Mm-hmm.
So Lina Strandbackman, as head of the innovation platform at Sahlgrenska Hospital, which we heard about from the former talk and which has been sort of hinted on several times during this conference, you're in a way the one of the participants who is closest to the hospital system. So how can innovation support in the hospital system support both the healthcare system and still ensure the quality of both the care, but also the innovative research and the innovative utilization of the research?
Hi, very nice to be here, Bo. Thank you. Yes, as you know, I'm representing that part of the innovation ecosystem that actually is within the healthcare system. So we really have to make sure that we have a capable organization, a capable system that actually collaborate with both industry and academia in every type of innovation project that is there. But it is quite important because we have seen a lot of interesting stories. Angela is one of them, where you actually start an innovation process by building a company or start something that is concrete and well, make use of the research results that you have that way. What we have to do also within the healthcare system, start our initial internal innovation process and make sure that we also answer the questions that we have to take care of. We have, of course, our challenges in being tax funded. We have our main task also to produce very patient-safe care every day, an hour of the day. But of course, we also have to innovate, because otherwise, for sure, we will die. We will disappear as an organization if we can't develop. So we have a few challenges, but we also have a lot of opportunities, because we have people both within leadership teams that really encourage our colleagues to become more skilled in innovation and management. We have quite a lot of resources, both in financial fundings and also programs like the one that Caroline and Jakob talked about, that really try to build the competence and the people management. And of course, we also have to know how can we interact with industry, with the private sector in a sustainable way to make sure that the innovations that are produced and concretized by them can also one day be implemented and become of use for our patients. Because that is really, truly when the innovation will become an innovation. So it is important that we have a strong triple helix, or that we also become a strong system from our side.
But when you talk with, for instance, small companies and sort of bring innovation into the hospital or the healthcare system, one of those sort of really obstacles that often comes up is of course procurement. And so how do we deal with that?
Well, some people say we have to change the law. I would say maybe that is the case in some ways, but I think start with we have to understand the opportunities and the possibilities that are within the current law system. And first of all, make sure that we understand internally how to deal with that and guide our people and have the right internal measurements also to make sure that our people that are more experts in law and the procurement than I am, that they also stimulate and motivate people to purchase innovations. It is more complicated, and we have to, of course, be very humble to the fact that we have limited resources, we deal with tax money, and we can't just waste them. But on the other side of the coin, we can't waste them by just buying what we buy today and buy on low price and the existing solutions that we know of. We have to be open-minded and also make sure that we buy something that is a little bit more innovative. And it's not enough to just buy it and plug it into the wall and make sure that it's sort of supposed to work, but we also have to understand the huge change that we have to do within our system today. We may have to work disruptively different from how we do it today. We have made to close down certain clinics and open up others to really to fully gain the potential of these new innovations, because that's the whole idea with the most disruptive things. And as you understand, that is a lot of change management. There's a lot of trust and management and engagement, inspiration by the people working. And it is there. It's just that it's a bit difficult sometimes to make it systemized.
So Lotta Gummesson happens to be one of my first colleagues when I came back to Gothenburg like a dozen years ago when we worked at Innovationsbron. But nowadays you're the CEO of Sahlgrenska Science Park, which is kind of a business park but also an actor in the healthcare area. And also Sahlgrenska Science Park is co-owned by Chalmers, by Gothenburg University, by Business Region Göteborg, by the region, and now recently also by Mölndal, where there's some minor company located there, which talk with later. So those are a lot of sort of people whose interests you're going to balance. And how do you go along with that and still being sort of a driving factor in healthcare innovation?
Well, considering everything we say here today also, I mean, if we look at the world now, is changing at a speed that we have never seen before. And it's a complex world, and we need new perspectives and different perspectives. And that is actually all what a science park is about. And especially when we are owned by several different owners, as you said. And what our owners have done is, well, they have agreed upon and assigned an ownership agreement and have developed a clear and broad assignment for Sahlgrenska Science Park with the one overall purpose to strengthen the competitiveness of life science and health innovation in West Sweden. So how can we solve the issues that we see, the common issues with the different perspectives, different organizations and so forth? So I would say this is a very good platform for collaborating outside your own organization on an owner's level and also on the board of director level. So that's what we do actually. And what we see here is, okay, we come to the table with the different agendas from the owners. but with a common view of the possibilities, especially, and the hurdles in West Sweden, and how to strengthen it. And while we navigate here, as I said, then through the owners' meetings and the board meetings as well. And well, we can see that this works very well. And the model that Science Park represent is as being the node with a triple helix perspective is well established, especially here in West Sweden. So I would say that with the different focus areas from the owners, together we become even stronger.
If we sort of think about what the other Lotta said about sort of this ecosystem, I mean, I know some of the really good companies that have come out of the system have been traveling around a bit in the system. If you look at 1928 Diagnostic, for instance, that kind of started with support from the Innovation Office, then had its time at Sahlgrenska Science Park, then at GU Ventures, and then at Chalmers Ventures. So how do we avoid sort of holding on too long and instead support each other?
Well, if we are more people and more organizations around the table, I believe that is a possibility and not a hurdle. And just to comment on that, I think it was very good what you said before, Lotta, that we no wrong doors, and we should really look upon it as finding the best personalized way to move forward. Because Martin is one. I met you before in my earlier job, and I mean, you work in a certain way, and Angela, as we met before, she works in another way. So I think we need more actors in the innovation system, and to work together and to find the best way forward for the individual. I think that is the key here.
So Magnus Björstner, you represent AstraZeneca, but you're also the CEO of BioVenture Hub at the AstraZeneca site, which is an environment for life science growth companies more than startups maybe. But as we know, there's quite a long road from research ideas to growth companies. And from your perspective, what advice would you give to innovators who aim to be in your environment in a couple of years ahead?
Thank you, Bo. And hi, everyone. So I think the BioVenture Hub, as you say, we face companies which are a bit more mature, which means that the problems they struggle with today is the result of what they did or did not do yesterday. So I think, I mean, I will be a bit boring here. I don't like it, but I think this is really, really important. And we heard from Jakob, identifying needs and validating technology. This is really crucial, but what sometimes is forgotten is their willingness to pay. So it is not enough that there is a need and that you know it works if nobody wants to buy it. So I think my first advice is really to be careful and do the homework on the commercial opportunity. And in Sweden, we never want to talk about money. It's research, it's science. But in the end, if you go into this with the purpose to drive a business, it has to be a business. So once you fall in love with your idea, it's really difficult to change the pitch and change yourself. So I think spend effort early on to understand, if I am successful, will I really be successful? That's the first thing I would like to say, Bo. The other thing, which I think is a really underutilized asset, is people. We often see companies that come to us and they have a super strong board and all are scientists. I think use your board in a much more clever way than I see. Some people see it as a necessary evil. I think the board is an asset, and secure that you pick people that can really guide you with respect to where you need to be tomorrow, not only the problems you have today. The final one is about, again, the people dimension. It is, don't be afraid to ask for help. We see that we have today 30 companies in the hub, and some of them are really good in asking for help, and they get a lot of help. Others don't ever even consider asking for help. And I think the more you ask for help, the more help you will get. And people are often very, very willing to help you, but you need to ask. So be brave, dare to share your ideas. You will get things in return, I promise. And I think there has been an anxiety between industry and small companies and even the healthcare system as a whole, some anxiety to touch base. I mean, a couple of years ago, we were not even allowed to serve coffees because it could have been perceived as a bribe. And if we look forward, I mean, we all need to work together in a very closer way than I think we are doing today. And I agree what has been said, the more the merrier, but we need to support each other because I see it as we're all in the same boat. And some people claim it is an oil tanker and you can't change the direction, but you can if you sink it, and we don't want that to happen. So we should help each other.
I think that's a very good comment. And I read a very interesting study some years ago by why didn't Silicon Valley happen in the Boston area where all the sort of important computer companies of the 70s were located. And the conclusion was they didn't talk to each other. So things happened faster in California. And that's why sort of the Boston companies at that time didn't win that race. Now they have an environment in the biotech area, of course, which is very working well. But they maybe learn from that.
I mean, I think you touch upon something very important because companies don't speak, people speak. So pick the right persons to talk to and things will happen. If you end up with the wrong person, you will never get to where you need to be. So I think be a bit careful about and secure that you speak to the right people. You're not speaking to a company, you're speaking to a person.
That naturally leads me to the next question, a question to Claes. You're a professor at the Institute of Biomedical Medicine at Sahlgrenska, and I looked through your website and there was a lot of presentation and very interesting research with deep focus on mitochondrial molecular genetics. But I noticed you also do a lot of outreach work, and I would like to have a comment on that. Is being active outside academia important for working with both innovation and presentation of science?
So I don't think I'll answer your question actually, maybe, but because starting with mitochondrial diseases, because so mitochondrial diseases that I work with in mitochondrial genetics, these are very rare disorders. They are rare and they are sort of very severe disorders in many cases, leading to death. And there are no treatment whatsoever available for these diseases, almost at least. And the problem is that they are rare as individual diseases, but as a group of diseases, they are actually pretty common. It's the second most common genetic, as a group, second most common group of genetic disorders. So if you want to work with them, you cannot work within, one university or one country or one sort of, you need to sort of stretch across the globe. And if you want to develop medicine, you also need to interact with sort of clinicians all over the world. So I've sort of, and you also need to work with patient groups. You need to reach out to patient groups. You need to reach out to sort of disease organizations in different countries and sort of bring these people together. And that's a challenge when you work with these rare disorders, is that you really need to work with many different actors. And in our case, we've been working with sort of setting up a company just recently for mitochondrial disorders. And what we realized was that we actually had to bring in the clinicians that had all the big cohorts in Europe, from Germany, from Italy, from the UK, from the US, and so on, and talk to them and sort of work together to decide what can we actually do, what are the sort of what kind of symptoms are we going after? I mean, these are patients that sort of display so many different symptoms. What should we go for? Which patient groups are sort of accessible? So I would say that it's very important, and this is my take on outreach then. I think your take on outreach might have been a little bit different, but is that there are many sort of opportunities out there that cannot be handled within the local ecosystem, not within Gothenburg, not within Sweden, maybe not within Europe, that we need to sort of look sort of broader. And that's especially true when it comes to these the rare disorders. And for a long time also rare disorders were sort of regarded as commercially uninteresting, so there were no one worked on them. I think that perception has changed now, and many people see the rare disorders as sort of a starting point to create interesting therapies that might also be applicable to more common disorders. But this means that there are a great number of patients and individuals out there suffering from disorders where there have been very little science and where there are very little help. And I think we need to see outside the local ecosystem in order to attack that.
So this sort of being international from the start is a major, in your way, need for success.
Yeah. I think we have seen fantastic success stories here today. So apparently you can be extremely successful in many ways working locally, but there are some problems that you cannot sort of solve. You cannot sort of treat patients if there is just one patient coming to the clinic every 10 years in Gothenburg. It's very difficult to perform a clinical study.
Martin, in a way, I mean, you work with, which is kind of a generic problem. I mean, infections and infectious disease and treatment of those. But maybe the same thing of sort of being international in mindset and from the start. I guess that would apply to you also in your work.
Yeah, I mean, there's no borders as I see it. I mean, science and development doesn't have any borders. I think also you have to look at the market situation. Where is the market and where are the big players located? Because if you want to make a kind of fruitful business, you have to be at the right position, at the right place. And I've seen that with startups that, for instance, sometimes the market is in the US. I mean, it might be 85% of the market in the US. Then it's very difficult to run businesses from Sweden. You might need to be in the US. So that's something that you have to consider. And going back to what I said before with patenting, that's also, I mean, you patent where the market is. So, and rarely it's only Sweden, right? So of course, you have to have a bigger perspective.
Lina, I mean, both this kind of research and these companies, they need this international sort of outlook, but sometimes it's also seen that if you're not sort of at least halfway successful at home, it's perceived as not being, why can't you be a king in your own town in that way? And do you see conflict because in your role of sort of being working and really supporting the regional healthcare system, but also being this potential and support for these companies and this research that will have an international outlook? I mean, if we look at what Claes is doing, of course, eventually that will come home as results that will be facilitating the care in the local region with those few patients we have here, but it might take a very long detour before we come here.
Well, it was an interesting question, a lot of questions within it perhaps, but to start with, I think it's very important that we, of course, do whatever we can to become a strong partner for both regional and also international companies that may want to use our system and our patients and our professions here to develop innovations, of course. So that is important that we have an open-minded, but also both to local startups and research teams that have started their journey here, of course. But also, I mean, potentially attract also international players that would like to invest in the region of Västra Götaland and the system here. So, but I know it's a bit difficult sometimes to know how to get in and how to actually to interact with the healthcare system in a thorough way and a sustainable way. And I hope that people in general, and also those who listen to us can contact us or contact our clinical colleagues within our system called Gothia Forum to actually help you, to guide you through into the environment that you would like to work with. Many of you have your own contacts, you do the research together already today, but in the very end, you may need a little bit of a coordination, administration work, legal support, whatever, that may not be first on the table when you start your collaboration, but need to be taken care of in the long run. That's where people like us and like my organization would like to support also. Because in the long run, we want the best innovations and the best research results to reach our patients, of course. That is really the main goal, of course, for us. So I don't know if that was an answer to your question, because it was a bit broad.
We're a bit broad, but maybe yes. Kind of mindset. And we've heard a lot about this sort of the need for local collaboration, need to understand what we can do together. But I see your finger, Lotta Gummarsson. So, but I actually would like to pose a question to both you and to Magnus on this. What makes us attractive for international actors to come here and say, I mean, what should we do to be seen from the outside as a place where something interesting happens? I want to come here for some time and participate. So Lotta and Magnus, what would you?
Okay, I don't know, Magnus, but I was more thinking of what Martin said. Your research collaborations around the world are really crucial and important. And if you want to attract investors, then you need to think outside Sweden and the Nordics. And you need to look at the global market. I mean, the market share of a total business in Sweden is only like 1 to 2%. And you will never make a successful business out of that within this sector. So you need to show an investor how to go out to other markets and go into other markets and so on, and to know them pretty well. As you said, Martin, to go into a market like US, you have to be there. And especially if you want to attract investors believing that you will know the market really thorough. So I think it's really a matter, again, of knowing the global perspective. And then what is unique about us? Well, we are still considered to be like a VIP country in some contexts. We are good at collaborating. We have some uniqueness when it comes to a high level of education and so on. So, but it's, I mean, it's now, and we have to work on it every day. Magnus, I mean, what do you see? Why do people want to come to work for a global company such as AstraZeneca and come to BioVenture Hub from abroad?
Well, we have some of the best horizontal rain in the world. Muted, Magnus.
I just said something very clever. No, but seriously, we have companies that have joined the hub from UK, Switzerland, US, Holland today. And I think if we talk about moving your company, you will move it to where you find it's best for you. It's very simple. And I think in our case, it has been the fact that we at least have been able to produce the optics and a story that is compelling to these companies about access to competence and infrastructure and what have you. But I think the key question to me is, and we have heard it in other words today, we heard about the struggle between publish too late and patent too early, and that's partly driven by system factors and incentives. We heard about procurement, that stops action. We talked about laws, and a lot of, to make this really interesting, is outside our control. And I think we need to be clear with those who make those decisions what is required. I see the drive Israel is doing now by using patient data to attract the coolest companies in the world, and they will move there. So I think we need to ask ourselves, from a business perspective, what makes sense? And then I think we can use the horizontal rain as icing on the cake, but it takes more than that to really be competitive in this area. And we need to be innovative in what we do, because we are a very small country. But I mean, there are some things which I still struggle to understand. Why can't we solve them? It's just to do it. But we can't do it ourselves. That's the problem I struggle with. So that was a boring reply, Bo. It was very negative, but I think sometimes you need to be clear on those matters.
So it's as much, I mean, we can collaborate to some extent, but then we need policy implementation for changes. That's essentially your message.
No, but take the discussion that is going on today with patient data. I mean, you need to do a full change of the law. And it takes the government 3 years to just review an existing law before they even start to think how to change it. And if we have that speed in this process, I mean, it's scary.
So the other Lotta, given these sort of constraints, I mean, what can an actor as Chalmers Venture do to develop these internationally outlooking companies, and also, as Magnus was alluding to earlier on, how do we make sure that we develop things that are actually needed and wanted, and in the end someone will be willing to pay for?
I think that first of all we have to realize that all our companies are acting on a global market immediately. There's no doubt about it. Although being present in Gothenburg or in the region does not mean staying here or just viewing Sweden as the market. So, and that, I think that's a mindset that I feel that most companies, most innovators, entrepreneurs have from the get-go. So yeah, collaborate internationally, gain presence internationally, understanding where the money is, where the customers are, and that's something that we as a very early stage actor. I mean, we work with in a very early stage, and yes, we have some investment capital, but that's the very early stages. That will never be enough to take it into what the other Lotta, then, if I say that Lotta mentioned, with the international investment capital and what Thomas was talking about, what exists within, for instance, Silicon Valley. And we need to work with a business mindset from the get-go. I don't think you're negative, Magnus, at all. I think you're realistic. And it's about setting the expectations and understanding what will it take to actually transfer research results into something that will benefit society. And I think that's something that we all share. I don't see it as those views contradict each other at all, but we need to dare to talk about it and work with that while developing the technology. And that's an important role that we have to take on.
Magnus, you had a comment.
Yes, I think we have to separate. I mean, I had a call from a company today, a Swedish company that chose to move to the US and says, we now want to move our company back to Sweden. We find it's a better climate for innovation. So I think we need to separate the discussion, whether it is about market or whether it is about developing innovation, because the market is global, period. But what we need to do is to allow people to make them find it attractive to develop it here. Because then the IP will sit in Sweden, the company would have their mothership in Sweden. So the way I experience is that when we discuss these things, people immediately think about rules for commercialization of new products and new medicines. That should be very rigorous, but we can't be equally rigorous when it comes to testing out new ideas. We don't have a rule work that is there to support idea generation and validation of ideas. We use the same rule framework for commercializing a product as we do for testing an idea. And I think that's where we can be innovative in separating the purpose of why we're doing things with, I mean, the framework that surrounds it.
So Martin, you had a comment also.
Yeah, I wanted to comment a little bit on this making money that Magnus was talking about a little bit before, and I think that's part of this kind of ecosystem that we have here presented. I mean, in the Western Sweden region here, and I think as an entrepreneur, I mean, if you have a business idea and you can talk about it, you should talk about it. I mean, you should talk to the market. I mean, you should schedule time with the big companies or the potential future customers as early as possible. You can never be too early in that respect. You say, is there a market? Is there an interest? Then, of course, you have to kind of, they always say that they're interested, polite people, but you have to kind of see beyond that and see if you can get some collaboration or the next step. And I think that it's a big part of this ecosystem here to help out, to find these companies and these potential future customers, to talk about this as early as possible, so we don't kind of solve problems that no one is ready to pay for or doesn't really exist. I think it's important to have that communication, and I guess that also goes with I mean, the innovation platform and clinical trials and so on. What is possible and not possible. So I guess we get back to interaction between people and meeting places, possibilities to discuss innovations and the next steps.
So with that said, Claes, I mean, if you and your research team would kind of stumble upon a kind of a treatment or a diagnosis of one of the rare diseases you work with, would you know where to go with those results? And do you think there's an environment where they could be, the initial development could start here?
So when it comes to drug development, that's very difficult to do in a city like Gothenburg, I think, and that has to do with the fact that you need to have a lot of, I mean, unless you want to work with AstraZeneca, of course, but I mean, if you want to work with high throughput screening and you want to have all these resources and so on, you need to do that very early on in a professional setting. You don't want to do that in your own lab. There are some places in Europe which you can go to. You have the Max Planck system that I've been working with a lot, that has their own sort of lead discovery center that work with this and so on. We have the SciLife lab system in Sweden, but it is a little bit cumbersome. And I think actually one of the problems we have, maybe you've talked about this yesterday when I wasn't here, but it's actually the teacher's exemption. I think actually it's a big problem that we own our own patent rights and that we need to sort of make all these negotiations ourselves. It would be much better if the university and the institute sort of own part of it, and there would be much more of a commercial incentive to actually develop very professional organization that sort of have interactions with the big companies and sort of see to it that they protect the professors' rights and the teachers' rights in a good way, and I think from working in Germany, I can say that it's completely different. I mean, they take a lot of your what you find away from you, but they give a lot of things back to you when it comes to sort of money and support and everything. So I think that's something that's worth discussing.
It is a hot subject, and I think we could have a whole day seminar on that topic alone. But and there are many views on how to tweak that system in different ways. All examples are not good, but there's definitely things that need to be changed. I would like to come back to another thing, that this testing aspect that Magnus said, and in the hospital system, sometimes it's kind of cumbersome to test things. I've heard or seen rather, maybe medtech projects that have very interesting for the hospital, but it's been hard to find sort of the right testing environment. Is there a potential for have more of sort of safe zones for testing at the hospital, where maybe you sort of confine an area for testing where slightly other rules are applied?
Would you like me to comment on that?
Yeah.
Yes. Well, first of all, I mean, as you know, and everybody knows this, that we can, of course, not test dangerous products on true patients. That would be very irresponsible of both the company and the hospital, but that is obvious for everybody. But there are lots of initiatives where you really try to make either some kind of test environments. They could be simulated environments. It could be more or less fake environments that you have actual people working and everything. And of course, that is also, I think, important that we stimulate that type of environments to make sure that people actually get something tangible to try and to get feedback on, and et cetera, et cetera. I mean, that is a part of the process of developing medicine, medtech, of course. So it has to be done. And I can also see that if you actually get invited and get into the clinical environment with your medtech products in a safe way and everything, that tend to be very inspiring also for the people working in the hospital. I mean, if you do that in a good way, and that would inspire people to think new and think, open themselves to change and to find opportunities also to do their current job in a slightly different way. So really encouraging the worlds to meet in a clinical environment and go there and dare to go there with, of course, everything that has to be done with safety and regulations of everything that you're using. Well, perhaps pay for the infringement in the environment, etc. But that is just practical stuff that has to be taken care of. Was that an answer to a question, Bo?
Somewhat.
And I can also see that from a governmental perspective, Vinnova, etc., they are putting huge investments on actually developing this test environment within the life science sector, medtech and others, of course. And I think we all should try to grab these opportunities that will come and make sure that some of these environments are actually ending up here in our parts of the country. I think we have a great opportunity coming up there.
So Lotta Gummersson, before I let you in, I think what we heard previously about the clinical residency program is one way of doing this kind of learning from each other. And something that was discussed in the panel yesterday was the Formula X project, which is very successful collaboration between mainly Chalmers and AstraZeneca, but we also have other actors. And I know that was sort of formed from personal relationships between people that started the trust that grew into this very big project. So Lotta, you had a comment.
Yeah, just to comment on that, I think, I know that we have a huge possibility in Sweden to be like the global test bed for new drug development, for new health tech companies and so forth. But we need a lot of change in the policies and so forth. We need the politicians to act now, and because we have that renommee in the world. So we meet a lot of companies contacting us. Can we verify our idea, our innovation in the hospital here? Can we be easily connected to some to larger companies and so on? But we are not there yet. But I see this potential here definitely. But we have to act together, and we have to bring on the politicians, and they have to move now. That's what we see.
Good words. And before we round off and hand off for the closing of this seminar, I just would like to have this short comment. I don't know how much you've been able to listen in to these 2 days, but do you have any kind of take-home message from what you heard? Maybe starting with Martin, who's been very much involved.
Well, I think it shows and highlights the importance of collaboration. Mm-hmm. That if you want to make a difference in this area, I mean, you have to collaborate. You need to have expertise from different areas. So that I would say is one of the take-home messages from these 2 days.
Claes,
I was going to unmute myself. I was actually thinking about the Brånemark and titanium and this enormous development that we have had, both when it comes to, with osseointegration in different sort of applications. And how he sort of discovered that by coincidence when he was working on, I think, studying some hematological question in rabbits, and the instruments got stuck. They sort of grew into the bone there because he was using titanium instruments. And that fluke observation sort of have led to a large industry here in regionally, and sort of expanding outside in the world, of course. And I think that I've been working for many years with the Nobel Prize in Chemistry. And what I've seen there is that many of our laureates, they have actually, you listen to the sort of fantastic basic science discoveries, but many of them have been involved in extremely successful startups also. So like Greg Winter, that got the Nobel Prize in 2018 for using phage display to develop new antibodies. I mean, he was instrumental in and started a company that developed Humira, that is was at least a year ago the best-selling drug in the world. And you have people like Aron Klug, who's the most basic scientist that you can ever come up with, but that started a company which is now Sangamo Therapeutics, located in California, a large and very successful sort of company. And you can go back. I mean, you have Crick and all. So I think this link to basic science and to excellent basic science and to discoveries, we shouldn't forget that. It's not only about developing, it's about sort of finding things, and then when you find it, realizing that you have found something that's important. Yeah, that's something I was thinking about Brånemark, a great scientist.
So I think with those words, which sort of puts the link between sort of basic and fundamental research to utilization, I will thank the panel, because the true moderators of the seminar is coming up on the scene, and I think it's time for closing this off. So thank you so much for the discussion, and I hope you all enjoy this session. Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Bye.
Bye. Thank you very much, Bo, for moderating this session, and thank you to our panel for a very spirited and thoughtful discussion. So this wraps up 2 very content-rich days. I've had a lot to absorb. How about you, Martin?
Yeah, it was intense, but really interesting, and I really enjoyed it. And it's a lot of people who made this possible. Of course, we should thank again all the speakers and all the panelists. Without you, this would not have been such a success, at least in my eyes. But to get the program together, we had a nice group working, and I would like to acknowledge those people: Alessio Degni from Gothia Forum, Henrik Hagberg from Sahlgrenska Academy, and Henrik Minderdal from Medtech West. Helene Lindström, who was at Medtech West and is now at Sahlgrenska University Hospital. Ann-Sofie Kahns, our health engineering area of advanced director. And Cecilia, you were the one who actually structured our sometimes very inspired but also a bit confusing discussions. So that was great. We also had a lot of support from our area of advanced coordinator, Ann-Marie Wöri, and administrator Gunilla Säte. So thank you very much for that as well. Our technicians here in the room, Peter, Matthias, Thomas and Kari. You saved me from ending a session 15 minutes early, that's one thing, but you also made all this production work smoothly, so we're really grateful for having you here. And finally, I would like to address maybe the key person behind everything here. So even though it's not in her job description, Mia Malmstedt, you've been the acting project leader of the entire production, so without you, we wouldn't be able to be here today. I think you have followed up a lot of loose ends, so thank you very much for that. And thank you for Cecilia for great hosting. It was good to be here with you.
Back at you. And thank you to the audience for joining us and for participating with great questions. We have had some questions that arrived a little late, but we will see what we can do about answering them somehow.
Yes, and now we're happy to hand over to Göran and his colleagues at the Faculty of Science at the University of Gothenburg for the next edition of Engineering Health. So by that, we say thank you from Runan and wish you a very good evening.
Thank you and goodbye.
Bye.